Navigating difficult family dynamics can be challenging, especially when it involves setting boundaries. The key is to protect your well-being without feeling guilty. Here's how to manage challenging family relationships while maintaining personal boundaries. 1. Acknowledge your needs. The first step in setting boundaries is recognizing your own needs. Reflect on what makes you feel comfortable and safe, and understand that prioritizing your well-being isn't selfish, it's necessary. Acknowledging your needs allows you to establish boundaries that align with your values and emotional health. 2. Communicate clearly and compassionately. When setting boundaries with family members, clear and compassionate communication is essential. Express your needs calmly and without blaming others. Use I statements to take ownership of your feelings, such as "I feel overwhelmed when," or "I need time to myself to recharge." This approach reduces defensiveness and fosters understanding. 3. Be consistent. Once you've set a boundary, it's important to stick to it. Inconsistent boundaries can confuse others and undermine your efforts to maintain them. Consistency shows that you respect yourself and expect others to do the same. If a family member crosses a boundary, calmly remind them of your limits. Practice self-care. Setting boundaries can be emotionally draining, especially with family. Make self-care a priority to maintain your mental and emotional health. Whether it's spending time alone, pursuing hobbies, or seeking support from friends, self-care helps you stay grounded and reinforces your boundaries. Accept that guilt is normal. It's natural to feel guilty when setting boundaries, especially with close family members. However, remember that guilt doesn't mean you're doing something wrong. Reframe guilt as a sign that you're making positive changes for yourself. Over time, as you see the benefits of your boundaries, the guilt will diminish. Prepare for resistance. Family members may not always respond positively to your boundaries, especially if they're used to having unrestricted access to you. Expect some pushback, and prepare to reaffirm your boundaries calmly and firmly. Remember, their discomfort doesn't negate your right to set boundaries. Seek support. Navigating difficult family dynamics can be overwhelming, and seeking support from a therapist or counselor can be invaluable. Professional guidance can help you develop strategies for setting boundaries and coping with any emotional fallout. Support groups or friends who understand your situation can also provide comfort and advice. Know when to step back. In some cases, maintaining boundaries may require limiting contact with certain family members. If a relationship is consistently toxic or harmful, stepping back may be the healthiest option. This decision is difficult, but prioritizing your mental and emotional well-being is vital. Focus on what you can control. You can't change others' behavior, but you can control how you respond to it. By setting and maintaining boundaries, you protect your emotional health and create a more peaceful environment for yourself. Focus on what you can control: your actions, your reactions, and your well-being. Embrace the long-term benefits. Setting boundaries may be uncomfortable at first, but the long-term benefits are worth it. Healthy boundaries lead to more respectful and balanced relationships, reduce stress, and a greater sense of self-worth. Over time, your family may even come to respect and appreciate your boundaries. Setting boundaries with family is essential for maintaining healthy relationships and protecting your well-being. While it may be difficult and involve some guilt, remember that your needs matter. By communicating clearly, staying consistent, practicing self-care, and seeking support, you can navigate challenging family dynamics with confidence and without guilt.